Welcome back to Fox 43 Morning News at 9. Well, if your child is in school or daycare, you may be aware of that fast-moving stomach bug that has been going around. While it may only last a day or two, it seems to be fairly contagious in the way it spreads. And here to explain some of the trends that she is seeing is Dr. Vinitha Moopen from WellSpan Family and Pediatric Medicine at Rothsville. Thanks so much for joining us this morning.
Sure,
I can speak to experience on the stomach bug. My four-month-old brought it home as a gift to my family from daycare, and it's just so contagious, right?
Yes.
So talk a little bit about what you're seeing with this.
So we're seeing a lot of children, pretty much every age group, that's coming in with vomiting, non-bloody diarrhea, some low-grade fever, belly pains, and just tired.
And typically we see something like this pretty much every year, right? There's a new one that
Yep.
pops up.
Yeah.
But stomach bugs are hard to deal with because it's one of those things that when someone in the family gets it, it's the deniable dread of, oh no, this is going to spread, right?
Right. So it's pretty contagious. So you want to try your best to make sure that you're cleaning your surfaces, you're washing your hands. If there's laundry, you're setting it on the sanitary cycle. You're trying to keep as clean as possible. With small kids, it's hard, but try your best to keep things clean.
And so if it does end up at your house, besides cleaning, when you're in the thick of it,
Yep.
what can you do to help your kids out?
So you're going to focus on hydration. You want your kids to be hydrated at home as much as possible. So small, frequent sips of fluids all throughout the day as much as they can take. If they're not able to keep anything down, if they look tired, if their urine output comes down, then you need to bring them in, and we need to take a look, make sure they're not getting dehydrated. But just small, frequent sips. When they're sick, you don't want to give them large volumes because that's going to make them throw up as well. So hydration is key.
And hydration is always the worry. How often are these kids actually getting dehydrated when they have this bug?
So if you're good at the little sips frequently throughout the day, it usually within a day or two they're getting better on their own. We do, especially in the youngest and like the ones who are on the sicker side, we do see them come in, and sometimes we do need to send them to the hospital for some IV fluids, but it's usually again very quick and they bounce right back.
So after the bug has gone through your home and you're cleaning through everything, what are best practices there?
Just, Lysol everything. Any hard surfaces, just clean it really well. Again, laundry, I can't, say enough to put in the sanitary cycle if you have it. And then just make sure that, you're not sharing utensils, things like that, just as we would for any viral illness.
And I know a big question that comes up is because these things are so contagious. If one family member has it, should you kind of expect that everyone else is going to have it? Maybe don't send the other kiddos to school, that kind of thing when that's happening?
Well, if they're not symptomatic, I wouldn't keep them home. If they do have symptoms, then usually we say 24 hours that they don't have any symptoms, you can send them back. But if they're fine, it's fine to go to school. And one thing we do have to keep in mind is we do have the vaccine for rotavirus, which is a very common cause of vomiting and diarrhea and infectious diarrhea. So I would recommend that to all of our infants as well.
And what age can they get that at?
So they start at 2 months. It's a 3-dose series, 2, 4, and 6 months.
All right.
Yep.
Well, there's a lot going around, so 'tis the season,
Yes,
isn't it?
that is correct.
Well, Dr. Vinitha Moopen, thank you so much for being with us today. Of course, if your child needs to be seen by a doctor at WellSpan, we have the information you need to make an appointment. It's on fox43.com.